Come in.
As I'm entering the patient's room, I'm performing hand hygiene. Hi, my name's Nicole. I'll be your student nurse today. How are you doing?
I'm doing well. How are you?
I'm good, thank you. Could you tell me your name and date of birth?
Sure. My name is Stephanie DiFrancesco, and my birthday is August 24th, XX.
Good. And could you tell me where you are?
I'm in my house.
And the day and what month is it?
It's December.
And what day of the week is it?
Friday.
Good. So the patient is A&O times 3. And as we move forward in the assessment, I'm going to be assessing her speech. And so far, she is able to communicate clearly. And today I'll be performing a head-to-toe assessment, if that's okay with you.
That's fine.
Okay, so I'll start off by telling you 3 words, and if you could recall them a little bit later in the assessment, that would be great. So your 3 words are plant, table, and candle.
Okay.
Alright, so I'll start off by just assessing your scalp and skull. So I'm going to look for any critters or lesions and discoloration, and I don't see anything, so that's all good. And next I'm going to palpate your skull for any lumps or abnormal masses, and I don't feel anything. Do you have any tenderness when I'm touching your skull here?
No.
Good. Okay, so next I'll move on to assessing your eyes. So I'll start off by shining this pen light in your eyes, and I'll just have you look straight ahead.
Okay.
And follow the tip of the pen light in. Okay, good. So as I've noticed so far from this assessment, her pupils are equally round and reactive to light and accommodation. Next, I'm going to test your 6 cardinal viewpoints. So I'll move my pen light in 6 places, and I'll just have you follow the pen light with your eyes.
Okay.
So here I'm assessing for a nystagmus. And her pupils, or her eyes moved smoothly, so that all looks good. And next I'm going to assess your peripheral vision, so can I just have you close one eye? And tell me when you see the pen light.
No.
Okay, and I'll just move to the other side and do the same thing.
No.
Okay, good. So your peripheral vision is good, and next I'll move on to assessing your ears. So I'm just going to palpate your ear and move it around a little bit, and let me know if you feel any tenderness.
Okay.
And I'll do the same thing on both sides. Any tenderness there?
Nope.
And pushing in on your tragus, any tenderness there?
Nope.
Okay, and the same thing on the other side. And any tenderness there?
No.
Good. Okay, so next I'll be performing a whisper test. So I'm going to whisper a word on this side, and then have you tell me what it is, and then I'll whisper a word on that side, and I'll have you tell me what it is.
Okay. Apple. Banana.
Good. So she heard the 2 words. They were apple and banana. Next I'm going to assess her nose. So I'll just have you tilt your head up like this. And here I'm looking for any polyps or lesions, and I don't see anything. That all looks good. And next I'll just have you open your mouth and go ah. Ah. Okay, so your posterior palate and uvula both rose at the same time, which is good, and your tonsils look good. And I didn't see any lesions or any abnormal coloring either. Next I'll just assess your sinuses. So I'm going to palpate on your face. So first I'll start off with your frontal sinuses, ethmoid, and maxillary sinuses. Okay, and those will feel good. Any tenderness there?
Nope.
Okay, good. So next I'll move on to your trachea, and that feels midline. Any tenderness there?
No.
Okay, and now I'm assessing for her thyroid. Okay, that's all good. Next I'll move on to her lymph nodes. So I'm just going to feel her preauricular lymph nodes, postauricular, occipital, submental, submandibular, tonsillar, and anterior cervical chain, posterior cervical chain, and supraclavicular lymph nodes. And those all feel good. Any tenderness when I did any of
No.
that? Good. Okay, so next I'll just assess the range of motion of your neck. So could I have you move your head like this, and then like this, and then a nod yes, and up and down. Good. So her range of motion is good there. Bless you.
Thank you.
Next, is it okay if I take a listen to your lung sounds?
Sure.
When I place my stethoscope on your chest, just take a deep breath in and out.
Okay.
Okay, and I'll move over onto your right side. If you could lift your right arm to listen to your middle lobe. Okay, good. So your anterior lung sounds are clear to auscultation with no adventitious sounds or crackles or anything like that. Next, is it okay if I listen to your heart sounds?
Sure.
Okay, so I'm going to start off here, which is aortic, pulmonic, herbs, tricuspid, and mitral. Okay, good. So her heart sound sounded good. I heard S1 and S2 and no murmurs, gallops, or any abnormal sounds. Next, I'm going to assess your carotid arteries. So first, I'm going to give them a listen
Okay.
with the diaphragm and then the bell side of my stethoscope. So your carotid arteries sound good. I did not hear any bruise, which is good. And next, I'm just going to palpate one side at a time.
Okay.
Okay, so that all feels good. Next, I'm going to have you lay down to do an abdominal assessment, if that's okay. And if I could just have you lift your shirt up.
Sure.
So first I'm starting off by inspecting, and everything looks good. You are non-distended. And next I'm going to listen to your bowel sounds in all 4 quadrants. Okay, good. So I heard normal active bowel sounds in all 4 quadrants. And next I'm going to just palpate. So first I'll start off lightly palpating in 4 spots and let me know if you feel any tenderness.
Okay.
Any tenderness there?
Nope.
Okay, next I'll push down a little bit deeper and let me know if you feel any tenderness.
Okay.
And any tenderness there?
No.
Good, all right, you can put your shirt down. So I'm done with the abdominal assessment. Next, I will assess your range of motion in your upper extremities. So could you go like this for me? Okay, good. And then next I'll have you just put your palms out like this. And here I'm checking for capillary refill, and I'll do this on the pad side of her hand since she has nail polish on. And the capillary refill is less than 3 seconds. And then next I'm going to assess the radial pulses. Good, so those are 2+ and equal bilaterally in both of her upper extremities. And next I'll just have you hold your hand out again, and I'll flip it over, and here I'm assessing for her turgor, and that was good, so you're well hydrated. And then could you just hold your fingers out like this, and I'll give them a squeeze, or could you actually, other way, could you squeeze my fingers? Good, so your strength is good in your upper extremities, and then could you push against my hands, and then resist me pushing against your hands? Okay, good, so your shoulder strength and wrist strength is functioning properly in both, bilaterally. Next I'll just push against your knees and have you resist it, and then have you push against my hands, and then I'll resist it. Okay. So your strength in your hips and your knees is good, and then I'll do the same if you could resist my hands.
Okay.
And then push back on my hands. Good. And I'm looking here, and there is no edema in her ankles. Next, I'm going to assess capillary refill in one of her toes, and that was less than 3 seconds, which is good. And then I'll check her pedal pulses. And that is 2+, and strong in equal bilaterally, and then posterior tibial pulses. And that is also 2+ and equal bilaterally. Next, I will have you stand up if that's okay. And with your back to me, I'll just have you bend over and touch your toes. And here I'm just assessing her spine, making sure it's even and straight, and that all looks good. You don't have any abnormal arches or curvatures in your back. And while your back is to me, I'm going to listen to your posterior lung sounds.
Okay.
In six spots, and I'm going to make sure that I don't place my stethoscope on her scapula. Good, so both her anterior and posterior lung sounds were clear with no crackles or anything or rhonchi, and I heard no adventitious sounds, which is good. Next, while you're standing, I'll have you hold your arms out like this and close your eyes. And she's not swaying or losing her balance, so your balance is good. You can open your eyes now. And then I'll have you just walk forward and back. And here I'm assessing her gait, and her gait looks good. She's able to still hold her balance while walking and has good coordination. And next I'm going to have you copy me, touching your thumb to all of your fingers. Okay. Good, so there I was just assessing her fine motor skills, which are good. And could you recall the 3 words that I asked you to remember in the beginning of the assessment?
Yeah, candle, table, and plant.
Good, okay, so her short-term memory is functioning properly. I can have you sit back down now. And can I get you anything else before I leave?
No, I think I'm okay.
Okay, so one last thing is, as I've been assessing Stephanie here, I've noticed her skin head to toe, and she is free of any wounds or cuts, lesions. It's warm and dry, intact, and it's a nice pink color, It's all normal. So let me know if you need anything else, and I will see you later.
Okay, thank you.
Bye. Performing hand hygiene as I leave the room.